Understanding IVF. In vitro fertilization is a process of fertilization in which an egg is combined with sperm in vitro. The process involves monitoring and stimulating the ovulatory process, then removing an ovum or ova from the ovaries and enabling sperm to fertilize them in a culture medium in a laboratory. In vitro fertilization, IVF, is one of the most widely used forms of assisted reproductive technology. It involves retrieving eggs from a woman's ovaries, fertilizing them with sperm in a controlled laboratory environment, and then transferring the resulting embryos into the uterus. The ultimate goal is a healthy pregnancy and live birth. IVF bypasses many barriers to natural conception, giving couples and individuals a chance at parenthood when other methods fail. Why IVF may be needed. There are several reasons individuals or couples turn to IVF. Blocked or damaged fallopian tubes where the egg and sperm cannot meet naturally. Male factor infertility, such as low sperm count, poor motility, or abnormal sperm morphology. Ovulation disorders, including irregular or absent ovulation. Endometriosis, which can distort pelvic anatomy and reduce fertility. Unexplained infertility, when standard investigations reveal no clear cause but conception does not occur. Genetic concerns, where IVF with pre-implantation, genetic testing, can help prevent passing on inherited conditions. Age-related infertility, as ovarian reserve and egg quality decline significantly with age, especially after 35. Same-sex couples or single parents, who may require donor eggs, sperm, or surrogacy to achieve pregnancy. The IVF process in detail. 1. Ovarian stimulation. Hormonal medications stimulate the ovaries to produce multiple mature eggs instead of the usual single monthly egg. This increases chances of retrieving viable eggs. 2. Egg retrieval. Once follicles mature, a minor surgical procedure guided by ultrasound is performed to collect the eggs. 3. Sperm collection and preparation. Sperm is collected, either through ejaculation or surgical extraction if needed, then washed and prepared for fertilization. 4. Fertilization. Eggs and sperm are combined in the lab. In some cases, a single sperm is injected directly into an egg, ICSI, intracytoplasmic sperm injection. 5. Embryo culture. Fertilized eggs develop into embryos under carefully monitored lab conditions for 3 to 5 days. 6. Embryo transfer. The healthiest embryos are selected and transferred into the uterus. The procedure is simple and usually painless. 7. Luteal support. Hormonal medications, often progesterone, are prescribed to prepare the uterine lining for implantation. 8. Pregnancy testing. About 2 weeks after transfer, a blood test is done to confirm pregnancy. Success factors and challenges. Prepare mentally for possible disappointments and repeated cycles. Communicate openly as a couple to strengthen the partnership under stress. 4. Adherence to medical instructions. Take medications exactly as prescribed, without missing doses. Attend all clinic appointments for monitoring and testing. Report any unusual symptoms promptly, especially during stimulation or after embryo transfer. 5. Financial planning. IVF can be costly, so plan realistically for multiple cycles. Explore insurance coverage, financing options, or alternative funding methods. 6. Patience and realistic expectations. IVF may not succeed the first time. Preparing emotionally for repeated cycles can reduce disappointment. Understand that age, egg reserve, and medical history are not under personal control. Summary and conclusions. IVF is a breakthrough technology that brings hope to millions facing infertility. It offers solutions for a wide range of reproductive challenges, but it is not a guaranteed path to pregnancy. Success depends on multiple medical and personal factors: the age and health of the woman, the quality of sperm, the skill of the fertility team, and the discipline of the couple or individual undergoing treatment. Personal responsibility plays a decisive role: adopting a healthy lifestyle, adhering to medical advice, planning finances, and cultivating emotional resilience. IVF demands patience, persistence, and realistic expectations. For some, it results in the joy of parenthood. For others, it becomes part of a longer journey that may involve multiple cycles or alternative Paths such as egg or sperm donation, or adoption. Here's a step-by-step breakdown of the IVF process. 1. Ovarian stimulation. Fertility medications are administered to stimulate the ovaries to produce multiple eggs. This process is monitored through regular ultrasounds and blood tests. 2. Egg retrieval. Once the eggs are mature, they are retrieved from the ovaries using a needle guided by ultrasound. This procedure is typically performed under sedation or anesthesia to minimize discomfort. 3. Sperm retrieval. A semen sample is collected from the male partner or a sperm donor. The healthier sperm are then separated for fertilization. 4. Fertilization. In the lab, the collected eggs are mixed with the sperm to allow fertilization. In some cases, intracytoplasmic sperm injection, ICSI, may be used, where a single sperm is directly injected into an egg. 5. Embryo culture. The fertilized eggs, now called embryos, are cultured in the lab for several days. The embryos are monitored for proper development. 6. Embryo transfer. One or more healthy embryos are selected for transfer into the uterus. This is usually done using a thin catheter guided by ultrasound. 7. Follow-up. After the embryo transfer, the patient will undergo a pregnancy test after a couple of weeks to determine if the procedure was successful.
If you find this video helpful, like, subscribe or follow my Health by Dr. J for more important health videos.